Welcome. In today's video, we will talk about 12 early signs of kidney failure. Let's take a look. The most dangerous thing is that most people are unaware that their kidneys are slowly getting damaged. Every day, thousands of people ignore the signs their bodies are giving, warning them about possible kidney problems. The truth is that there are 37 million people in America with kidney disease, yet 90% of them have no idea that their kidneys are gradually failing. This small organ filters about 50 gallons of blood every day. When it weakens, the body displays specific signs. In this video, we will learn about 12 dangerous warning signs often mistaken by people as normal fatigue, aging, or stress, and thus they tend to ignore it. But in reality, these are the early signs of kidney damage. So, without delay, let's begin the detailed discussion. Number one, fatigue and weakness. Often, over after a full night's sleep, people feel fatigued and as if their bodies are trembling in the morning. They frequently rely on tea or coffee throughout the day due to excessive tiredness, where even simple tasks seem hard to accomplish. This is not ordinary fatigue but possibly a common sign of kidney problems. When the kidneys are not functioning properly, toxic waste accumulates in the body, reducing the blood's capability to carry oxygen. Damaged kidneys produce less erythropoietin, a hormone responsible for making red blood cells. Studies suggest that nearly 60% of people with chronic kidney disease develop anemia. According to the American Journal of Kidney Disease, with fewer red blood cells, oxygen delivery to the brain and muscles diminishes, leading to persistent feeling of tiredness and weakness. This ongoing fatigue is often attributed to stress or aging, but in truth, it signals kidney disease. Number two, metallic taste. When food begins to taste metallic, it is not just irritating but also a sign of toxin buildup in the blood. According to a study, uramic toxins directly affect the taste buds and olfactory system. As a result, there is always a persistent metallic or ammonia-like taste in the mouth, leading to a loss of appetite. The body grows weaker, becomes malnourished, and weight decreases. Often, this issue is accompanied by bad breath with an ammonia-like odor due to the release of toxins through breathing. Number three, swelling in feet and ankles. Often people feel like their shoes are tighter or notice deep marks left by socks after removing them. They assume this is due to long hours of standing, so they dismisses it. However, in reality, this is a specific sign of kidney disease. Healthy kidneys remove excess salt and water through the urine, but damaged kidneys lose this ability to regulate the balance. As a result, excessive water accumulates in the body's tissue, causing edema, which typically collects in areas like the feet and knees. This is not simple puffiness caused by eating salty foods, but rather a progressively spreading swelling from feet, legs, and hands to the face. Number four, changes in urination. Changes in urination are definite signs of kidney damage. The most alarming indication is foamy urine, which looks like the froth from beaten eggs and does not disappear quickly. This foam is actually protein, which should not be present in the urine. Healthy kidneys keep protein in the blood, but damaged ones may start leaking it. According to the Clinical Journal of the American Society of Nephrology, proteinuria is the first sign of kidney damage. Another sign is nocturia or frequent urination during the night time. Number five, shortness of breath. It is not uncommon to find that climbing the same set of stairs that used to be effortless now becomes difficult and leads to irregular breathing afterwards. Many people immediately think this is due to heart or lung problems. But in truth, it could be a kidney issue. According to the American Journal of Kidney Diseases, a comprehensive study conducted on more than 4,000 patients confirmed that shortness of breath is the most common sign of kidney disease. The first reason for this is anemia. When there is a lack of red blood cells, the oxygen being transported throughout the body is reduced, causing weakness. The second reason is the kidney's failure to remove excess water, leading to water accumulation in the lungs. When the air sacs in the lungs are filled with water, it becomes difficult for oxygen to reach the blood, making the person feel like they are drowning within themselves. Number 6, dizziness and vomiting. Persistent nausea without any clear cause, disgust for foods, or a loss of appetite for one's favorite dishes. All of these could be signs of toxins accumulating within the body. When the kidneys fail to function properly in filtering waste, toxic substances build up in the blood known as uremia. According to a study, these toxins irritate the stomach lining and also disrupt the brain's control over appetite. This results in persistent nausea, vomiting, and a complete loss of interest in food. As kidney damage worsens, this problem becomes more severe. Number 7, persistent itching. Itching that appears to come from within the body and worsens when scratched is not the usual type of itching associated with dry skin or allergies. This type of itching is felt throughout the body and can cause extreme discomfort. According to research from clinical nephrology, up to 90% of people with advanced kidney disease experience persistent itching. When the kidneys fail to filter out toxic substances like phosphorus and urea, these substances accumulate in the blood, leading to itching. Number 8, muscle cramps. Muscle cramps and pain are common symptoms but can become more severe when there is a kidney issue. These are not the usual cramps after exercising but rather more intense and frequent cramps that occur even during rest. These kinds of cramps, especially in the legs, could indicate that the kidneys are struggling to maintain a balanced level of minerals in the blood. Healthy kidneys regulate the appropriate levels of sodium, potassium, calcium, and magnesium. When kidneys problems occur, this balance is disrupted, leading to severe pain and muscle cramps. Number 9, poor concentration or brain fog. You often enter a room and forget why you went there. Even if you repeatedly read a paragraph, you still can't understand it. This is not just a result of stress or aging, but could be a sign of kidney problems. Research indicates that when the kidneys can no longer filter waste products, these toxins circulate throughout the body and eventually reach the brain. These toxins cross the blood-brain barrier and disrupt normal function of the brain. Doctors refer to this condition as uremic encephalopathy, which weakens memory, concentration, and understanding. Number 10, swelling around the eyes. According to research, the area around the eyes is the most sensitive to fluid retention because the skin here is thin. When the kidneys fail to filter proteins like albumin properly, these proteins end up in the urine. The loss of protein disrupts the body's fluid balance, causing fluid to leak from blood vessels and accumulate in the tissues. This is why swelling is first noticeable around the eyes. It is usually more pronounced in the morning. Number 11, high blood pressure. If your blood pressure readings are consistently high and cannot be controlled with medications, it may signal kidney problems. Research shows that the kidneys play a critical role in regulating blood pressure. They control the amount of fluid in the bloodstream, produce hormones that regulate blood vessel function, and maintain sodium-potassium balance. When the kidneys are damaged, they can no longer remove excess sodium and fluid from the body, increasing blood volume and pressure. Additionally, damaged kidneys produce excess renin, which constricts blood vessels and further raises pressure. Number 12, dry and flaky skin. If your skin has become unusually dry, flaky, or extremely itchy, and this persists despite the use of moisturizer and adequate hydration, do not dismiss it as a mere cosmetic issue. It could be a sign of a serious imbalance in kidney function. Our skin reflects our internal health. According to research, healthy kidneys maintain the balance of minerals, vitamins, and nutrients essential for skin health. When kidney function is impaired, this balance is disrupted. They fail to regulate phosphorus, leading to a calcium-phosphorus imbalance and damage to skin cell function. Examine yourself for any of these symptoms and consult a doctor immediately. to address the issue early. Your doctor may recommend two simple tests: a blood test to check creatinine and GFR, and a urine test to check for protein. These two diagnostic tests can detect kidney disease in its early stage, making treatment much more manageable. Alright, thanks for watching the video. Please subscribe to watch more. Have a nice day.